All right, thank you.
Ready to go?
Good evening, everybody. I'm Mayor Woody Washam of Cornelius, and happy that everybody has joined us tonight for the evening edition of Connecting Cornelius. This is a quarterly event we have in the evening for those that can't attend our morning sessions, which we have every first Monday of each month, unless there's a holiday involved. So this is to keep you informed, and we're kicking off our new year with some great news and some great information. And I'm really pleased about the lineup of speakers we have tonight. It is interactive, so if you have a question, you can ask that question on the chat. So just type your comments or questions into the chat, and we will be happy to deal with those and address those. If they're in regard to any of our particular speakers, we'll certainly defer those questions to those folks. Nothing's off limits for us, and so we welcome your questions as we go through the evening. We'll be with you up to an hour, depending on the amount of questions at the end, and the interest along the way with the various topics that we have tonight. So again, welcome, and we're happy to have you, and we very, very much appreciate your interest in your town. Thank you so much. So with that, I want to turn to our town manager, Andrew Grant. There's always something going on at Town Hall. Our town manager, Andrew Grant, keeps us moving and floating on a day-to-day basis down at Town Hall. So Andrew, what's on your mind tonight? And appreciate it if you give us a little update, sir.
Absolutely, Mayor. Thanks for the introduction, and glad to see everybody. Happy New Year to everyone who's joining us. Just a few updates regarding the town. We have an important road project that we're beginning this week, and that's the Bailey Road 115 intersection improvement project. We're actually funding that with town funded bond money that was approved by the voters. So thank you, voters, for helping us improve this intersection. We'll be adding turn lanes and also extending turn lanes, and that project does start this week and will last up until about August as well. Leaf collection, our very popular leaf vacuuming service. This is the last week that we have that. So if you have leaves that you would like vacuumed up, please put those at the curb and we'll come by this week to do that. After this week, we ask that you bag those. Our contractor Waste Pro will collect up to 20 bags each week. On some little bit of recognition, I wanted to give a shout out to our finance department, and we've become very used to it and almost taken for granted the success and solvency, if you will, of our town's finances, which is led by the finance department. Julie Neiswanger, our finance director, and her staff do an excellent job each year with our finances and also our books. We have an annual audit that, knock on wood, always comes back clean and with an unmodified opinion. The North Carolina Government Finance Officers Association, which is the organization for finance professionals in government, annually we receive rewards from this organization, and this is our 10th year of receiving the award for the CAFR, which is our Comprehensive Annual Financial Report. 10th year in a row we've received that, so thank you to Julie and her staff. And then also the 3rd year in a row we've received the same award for the PAFR, which is the Popular Annual Financial Report. So kudos to the town staff for the finances. And then the last thing I want to mention, and we've been pushing this out, if you haven't filled it out already, we have our first ever town citizen budget survey, and it is online. You can go to our website to access it. It'll take you about 5 minutes to fill it out, and it'll ask you to prioritize what you think is important for services or priorities in town. So please do provide some feedback to myself and the town staff team, and also the mayor and the board, as we are at the very beginning of our budget process. And of course, this will last for many months and finalize in June. So please provide your input to us. With that, Mayor, that ends my report. Thank you very much.
Thank you so much, Andrew. A lot going on at our town hall. A lot going on down, if you dig down deep into the individual departments. We will make our rounds to each of those department heads at some point during this coming year. It helps educate all of us, but particularly our citizens, with what really goes on at town hall. I think you'll be surprised. So hang with us throughout the year. It's a great source of some fantastic information. Now, as all of you know, many of you have been on these events in the past. We can't really have an event right now like this to share information with our citizens without talking about COVID-19. I'll be so happy when the day comes that it is no longer a topic for Connecting Cornelius in any way. We'll get there, but we're not there quite yet. Actually, we have some, I think we have some improving numbers, but they're still very seriously concerning. So we have one of our leaders down at the Mecklenburg County Public Health Department, Dr. Raynard Washington, has been with us before, and he's going to give us an update, and he'll also be available to answer any questions that you may have. Again, if you would like to put those in the chat box on your screen there, I'll try to keep an eye on it, as well as some others that'll help me out a little bit, and we'll try to address those. So Dr. Washington, give us an update on COVID-19 and what's going on with that.
Sure, and thank you so much, Mayor, for having me this evening, and great to be with the town of Cornelius. So we are certainly at a challenging time in this pandemic for our community. I will say this is probably the most challenging season of COVID-19 that we've had in Mecklenburg County. As of earlier this afternoon, we were just shy of 80,000 cases of COVID having been diagnosed in this community since the beginning of the pandemic. Unfortunately, we've lost over 720 individuals' lives. We've had a real acceleration in deaths over the last several weeks. And as you probably have heard, we've had an increase in the number of cases that we've had. We've had an increase in the number of hospitalizations that we've had fairly significantly. The percent of our tests that are coming back positive has been elevated for the last several weeks. And we've just had a really incredibly high level of community transmission and spread. Just a couple of weeks ago now, or about a week and a half ago now, Gibby and the rest of the team here, we released a directive to our community members as what we felt to be a critical juncture in our response. The holiday season, we all know what happened over the holidays. We had folks in our community continuing to gather for the holidays, Thanksgiving, and then right after Thanksgiving, we had Christmas, and right after Christmas, we had New Year's. And so all those events really created a surge of cases, which just turned into, obviously, an increase in hospitalizations and deaths. So that is really where we are right now. The directive really is asking all of our residents to minimize their activities, to stay home for the next 3 weeks, at least through February the 2nd, which really offers us an opportunity to slow down the transmission in our community. As folks all probably know, there have been record number of cases really across this entire country, not just here in Mecklenburg County. And so we really are laser focused on being able to slow down transmission. The increased spread in our community has translated to not just cases in the county, but cases also in our long-term care facilities. We have nearly 60 long-term care facilities that are currently in outbreak status. And also we have a number of new outbreaks in schools as well. And this is not necessarily because those facilities or schools are not doing their best to try to keep the virus spread low. It's just there's so much spread in the community. The likelihood that you run into someone that's infected is just much greater than it would have been, let's say, 2 months ago. So that's the motivation behind the directive. We are asking folks to stay home as much as possible, only for essential reasons, which you leave home. And then we will hopefully start to see some real improvements. I'll say in our data release that's going to come out tomorrow, those come out on Tuesdays and Fridays, you'll see some improvements. Our percent positivity is starting to go down. We are finally under 500 people in the hospital, which sounds kind of like bizarre because just a few months ago, we had less than 100 people in the hospital with COVID-19. And we've been over 500 for the last several weeks, which has really strained our healthcare system. I'm sure some people saw the news today that Atrium has opened up a mobile hospital at Pineville because of the fact that their ER and their ICU has been so stressed for the last several weeks. And the hospitals are no different. We've had increased cases among staff at the hospital, so they're out on quarantine simply because there's so much transmission in the community. So this 3-week period is really intended to help us cool off a bit and try to slow the spread of the virus so that we can eventually get back to being, as the mayor said, some sense of normalcy. It's amazing to think that it's been a year since the first case arrived in the U.S. and it's been almost 11 months since we had cases here in Mecklenburg County. So we've been doing this nonstop, 7 days a week for all that time. So our staff is tired and have been working really hard, but are committed to this work. So that's sort of, I guess I'll say, the sad news here. Things have not been good. They're stressed. We've had our first child die in the last week and a half here in Mecklenburg County, and it's certainly that rings on our hearts in a way that is so different. Any life loss is a life that we care about, and obviously their family that are grieving, but it hits a special way when it's a kid, and so we're really working to make sure we don't have any more of that in our community, and we really want the spread to slow. Just a quick update on testing. Testing continues to be widely available in our community. I just want folks to know that there are places you can go to get tested. If you visit mecknc.gov/COVID-19, we have a testing locator on there. You should not have to pay for a COVID-19 test. We have lots of free testing available across the entire county. There are a lot of new sort of vendors trying to pop up in gas stations and parking lots that are charging people to pay out of their pocket, and you should not have to do that. And so I just want folks to know that if you need a COVID test, you should go to one of your primary care doctor probably can do it for you now. Most of our primary care doctors are able to do it, especially those that are affiliated with our health systems. You can go to urgent care, or we have drive-through testing at the Northwest Health Department. We have drive-through testing at Bojangles, as well as a number of other sites across the county. So you should not be paying for a COVID test. Secondly, I'll say an update on the COVID-19 vaccine, which is a light at the end of a very long tunnel for us. We're really excited that the vaccines have been approved and that they're available, and are working as quickly as possible to get the vaccine out in our community as fast as possible and to as many people as possible. The first thing I'll say and reiterate to everybody here is that we're receiving vaccine from the federal government. that sends it to the states, and then the states redistribute the vaccine to each of the counties, providers in the county. In Mecklenburg County, the health department is one of those providers to date that have received vaccine from the state. There are two others, both of our health systems, Atrium and Novant Health, both have received vaccine from the state as well. And then Mecklenburg County receives its allocation directly. Right now, we're currently receiving roughly 2,000 doses a week. And we're currently vaccinating individuals who are in groups 1 and group 2. I know it's kind of crazy, kind of confusing, because these groups have changed a number of times already. And unfortunately, I can't promise you they won't change again next week. But we're going to continue to do our best to follow the best guidance that we get from the state and federal government. The federal government purchased the vaccine, so it's available at no cost to anyone. We currently, again, groups 1 and 2. So group 1 is any healthcare worker who has patient-facing contact. And then group 2 is any adult that's over the age of 65, and it's regardless of their living situation or any conditions they may have. The next group after group 2 is group 3, which is the frontline essential workers, who is a whole cohort of individuals who are essential to our infrastructure and our society operating. So that's law enforcement officials, law enforcement officers, the teachers, folks who work in schools, frontline folks who are not in the healthcare setting, but are essential to our society operating, grocery store workers. And then after group 3, there's group 4 and group 5. Group 4 is adults with chronic conditions. And then group 5 will be open to everybody. So I will tell you, based on the current supply of vaccine, it'll take us some time to get to group 5. I was saying earlier, we have about 120,000 adults over the age of 65 in Mecklenburg County. If you remember, I said earlier, we're receiving about 2,000 doses a week. So we got a ways to go to get from 0 to 120,000 for adults over 65 who want to receive the vaccine. So we are currently, again, we're lobbying the state as much as we can to pressure them to send us more vaccine. Our healthcare systems both have a large amount of vaccine as well that they're working to distribute. They are putting on some large clinics. One this weekend is happening at the Speedway. One in a couple of weeks is happening, or actually next weekend is happening at the Bank of America Stadium. And they will be doing pretty high volume at those. As well, they also have clinics that they're operating on a daily basis. The health department has a clinic at Bojangles Coliseum here in Charlotte, and that clinic is available, and we have appointments for upwards of 400 to 500 appointments per day. We did release more appointments this morning. The appointments, we released appointments for the first 3 weeks of February. So through February the 20th, and by middle of the day, all those appointments have been taken. So we are continuing again to lobby for as much vaccine as we can get our hands on in the department, and to make sure that it's available to those in our community who need it most and are most vulnerable. So I encourage folks to continue to keep an eye on the mecnc.gov/COVID-19 website, as well as continue to talk with your primary care provider. And we will continue to keep folks as up to date as possible. Again, let me just to level set again, I know we've had some challenges with folks calling and the website, but there's just an incredible amount of interest, which is so exciting for us. I mean, we're really incredibly excited that there is not extreme levels of vaccine hesitancy, and people are interested, willing, and excited about the vaccine. It is a light for it's our path out of this pandemic, at least one important part of it. That being said, though, our systems are really maxing out in terms of capacity. We have just so many people going on the websites and calling us. We've got a whole new staff of hotline staff, and even still, there's a large volume of calls. And so we just ask folks to be patient with us, be patient with our health systems. They also have a lot of volume of calls that are coming in, folks who are just calling to get information, others who are trying to make an appointment. And so we're doing our best, and we appreciate everybody being patient with us. And then we hope everybody in our community understands and knows that vaccines are safe and they're effective, and they really are a critical tool for us to get through and on the other side of this pandemic. I'll close by just saying, encouraging everybody to please adhere and comply with the directive. Stay home as much as you can. And most importantly, if you leave your house, please wear a mask. Avoid close contact with other individuals. Certainly maintain your 6 feet distance. And please avoid any kind of gatherings with people you don't live with. we are in a situation where there's, again, so much transmission, the risk that those that you love, your family members, are just much greater risk. And so we really got to get a better control over the transmission in our community. So thank you so much for having me tonight. I think I've reached my time, and I look forward to any questions.
So just a quick question here, Doctor. In relation to signing up for the vaccine, I do know that has been a source of frustration for many. And I hear tell of folks making multiple appointments, if you will, at different providers out there. So how would you help manage through that? It could be we've got a bunch of folks that have multiple appointments sitting out there, which is clogging up the system. So what's your advice on that?
Yeah, so that's a great question. My advice is to just make one appointment. If you are successful at getting an appointment, even if it's 2 weeks or 3 weeks from today, make that appointment and stick to it. There are, again, if we go back to the numbers I described earlier, we have a lot of people in line to get vaccinated. And so we want to offer an opportunity to everyone as quickly as possible. We have very tight inventory control over the vaccine. We have not wasted a single dose here in Mecklenburg County, and we're really proud to say that. And so we're maintaining our ability to control that inventory to make sure there are a lot of logistical requirements with the vaccine, especially the Pfizer vaccine. We have to keep it really cold and have to manage how much we open at a certain given thaw at a certain amount of time. So please only make one appointment. But if we have no-shows or cancellations, if you accidentally make 2 appointments, cancel the other one. But if we have no shows and cancellations, we're continuously making appointments available. So we're working to make sure that if a spot is open, we can fill that spot. We have everybody, it's literally all hands on deck across the hospitals and the county. Our medic staff have been incredible. Our EMTs, as you probably know, the National Guard is helping us. We have an additional 6 National Guard that were just deployed this week to help us. So we're trying to work as quickly as we can. So just, again, be patient with us. But also, if you have multiple appointments, please just minimize that to 1.
Thank you. So Dr. Miltich is our resident physician / commissioner. Doc, do you have anything you'd like to ask or add before we leave this topic?
Just Dr. Washington reminded me it's called being a patient for a reason. But anyway, yes, I look at the statewide data and it mirrors what's happening in Mecklenburg. There's a little bit of relief occurring in the last 7 days, and all I can do is pray that continues. But certainly we need to limit our exposure. This is spreading like wildfire, and we just need to separate so it quits going from person to person. So I'd echo everything that Dr. Washington has said.
Thanks, sir. Appreciate that. Okay, we'll come back to additional questions. So again, please add those in the chat box if you have those. I've seen one. We'll come back and address those when we get to our question period, which is after our overall presentations. Be glad to do that. And Dr. Washington, if you have time to stay on the line, that'd be fantastic if you could do that, because I suspect you're going to get some more questions, at the end as well. So with that, we're going to move to another topic on our agenda that's pretty near and dear to my heart. It's a project that's been in the making here in Cornelius for many years now. I've been a part of it along with several of our other commissioners, Commissioner Duke from the beginning, Commissioner Biodeau from the beginning, and certainly our entire town board along the way. And, we're really at a fabulous point in time now where we believe, actually, we know we're going to start construction on the Kane Center of the Arts in the next short while. The fundraising process has gone well. We're not done. I'm trying to do what I can for that and help Kane out. This is such an important project to our downtown area. The basis of it and the basis of the town support is certainly to raise our quality of life here in Cornelius, which is so important, but to provide redevelopment to our downtown. As you know, if you ride through there, as I do very frequently, particularly growing up here over the years, we need to give our downtown a little boost. And there's no doubt in my mind that this great development right in the town center will do just that. So I'm excited from an economic development standpoint. The phone's been ringing ever since we announced this project with folks that are interested now finally in our downtown and doing great things here. So there's a lot to come as it relates to downtown redevelopment. But we've got to get this center up and built first. And I just thought as fast as things are moving, it would be appropriate to ask our executive director, Justin Dion, to be with us tonight and continue giving us updates on this, because the snowball is building, and before you know it, we'll be breaking ground. So Justin, I don't want to steal your thunder. So please take off. And I will add that I have asked Commissioner Biodeau to join in as well. Commissioner Biodeau sits on the Kane Center for the Arts Board of Directors. I sit on that as well. And I've asked him to make some comments and weigh in on it along with Justin. So thank you, Denis, for doing that. And Justin, if you'll kick us off, and exciting news. Really excited to hear this update.
Great, thanks, Mayor. Appreciate you having me here today. Thanks everyone for being here to allow us to give you an update on the Kane Center for the Arts project. As the mayor said, we are absolutely full steam ahead. In fact, the list of items that we're working on just grows and grows day by day. We ended 2020 actually in a very great place as an organization and as a project. Happy to say that over in the year 2020, we still brought in, even though we were in some interesting and challenging times here, this project still saw the great support of the community, and we brought in just around $2.3 million in pledges and support throughout the year. So we were still able to have a very successful year in terms of our fundraising and our drive moving forward. Again, we did start selling bricks. Some of you here may be members of our Founder Society, or you may have purchased a brick. We thank you so much to those of you who've been able to do that thus far. And we're going to encourage those of you who haven't yet to go ahead and jump on board, because we are, to what the mayor said, we are going to be breaking ground here in the late spring. So we don't have a final date yet, because we need to wait and get everything's going to go to bid and get our contractor on board here around mid to late February. But once we get our contractor on board and do some site work, we'll be ready to start construction. And the plan is to begin in the late spring. That is all now on the calendar, on the books. We'll make sure that we have a great groundbreaking celebration. I can imagine it may be similar to how we did the demolition celebration. So we'll have to keep it as small. And then if, depending on how things are with COVID, if we can do an outdoor small distance celebration that we would stream online for everyone to celebrate, we'd love to be able to do that. So keep an eye out for that. But if everything stays on schedule with construction, we are, planning on now a grand opening for, December time, 2022. So all these times that we've been saying, we hope it's going, we can now say it's going. So we are moving forward. We are still, to the mayor's point, again, still raising funds. We've just surpassed over $18 million total secured for the project. So if you're, for my math people out there, that gives us about $7 million more to raise, that we're looking to do by the time we open. The Founder Society that you've heard me mention is a way that you can make a pledge payable over 2 years, and you can do that. And as long as you make that pledge before we start construction, you will be a Founder Society member. Now, we'll still be raising funds, and you can still obviously make a pledge after we start construction. But the Founder Society is limited to that time period for before we start construction. And Founder Society members is just a nice way to acknowledge and thank those who were able to join us and help the project really when we were still getting started. And Founder Society members, you get a great little lapel pin, gold lapel pin with the Founder Society logo. Your name will be acknowledged, or your family's name or business name would be acknowledged on a beautiful sculpture that'll be out in the public plaza. The Founder Society, Founders members sculpture there. And then also Founder Society members will have special ability to have like early access and early kind of knowledge on things that are coming to the center. So, imagine that if tickets go on sale for an event on a Friday, Founder Society might have the chance to buy tickets on like the Wednesday or Tuesday before that. So little fun options like that, fun little benefits like that are what the Founder Society members will get. So if you've been on the fence, now's the time to hop off, make that pledge, get it on the books before we start construction. Also,
Justin, while you're on that topic, I know we've had a question pop up about, so how much is a brick? How much does that cost, and how much does it cost to be at the basic level on the Founders? And
great, thanks. Yeah, thanks, Mayor. I appreciate that. Thank you for that question. I'll start with the bricks. That was first, I think. The brick, we have 3 sizes of bricks, and I actually usually have them right here on my desk, but they're right over there. Our bricks are 3 sizes. You've got a standard 4x8 size brick, which is $250. And then you've got a 4x8 brick, which is $500. And then you've got a 8x8 brick, which is $1,000. And we've got, right now we do have availability, for interior or exterior bricks. Although if you'd like an interior brick, you can only buy a $500 or a $1,000 brick, because all of the $250 level bricks on the interior are sold out. So we've sold out of those already. And then Founder Society pledge starts at $2,500. And there's levels that go from 2,500 to 10,000, and then from 10,000 to 25,000, 25,000 to 100,000, and then 100,000 and up. Again, those are pledges, so payable over 2 years. And depending on what happens, with administrations and everything, you may see some of the same tax benefits extended this year as were last year. We had a lot of our donors last year took advantage of those tax benefits that were allowed with the CARES Act. So keep an eye on that and see what happens. And there may be some extra benefit in that from a tax standpoint, although I am not a tax advisor, so do not listen to me on that side.
That also covers the engraving of your name and or company name or individual name.
Yeah, absolutely. Yes, sir, Mayor, it does. And I just saw a question pop up there. If you visit cainarts.org, that is our website, cainarts.org. It'll bring you up right to the homepage, and there's a button that says make a pledge. And there's a button that says make a donation. And if you want to make a pledge, you should hit the button that says make a pledge, and then you can do all that online. Also, if you'd like to purchase a brick, if you just scroll down that page, you'll be able to purchase your brick right there. And you can even fill out what you want the brick to say, and it's all handled online. Although you can you can email us, and we are happy, or call us. Our information's on our website, or you can even Facebook message us and find out. Real quickly too, I don't want to take up too much time, but some of you may have been able to drive by the site recently. Demolition is really coming along so nicely, and we're so grateful for Griffin Brothers Company for their donation of the demolition as an in-kind donation. We've got one big blue building down. The cotton gin is down, and we've saved a lot of lumber came out of that. They were able to save a good amount of lumber that's going to be repurposed as best as it can once they kind of clean it up and see what actually it can get out of it. And then that final blue building is coming down soon. Cool story about that is the final blue building actually, the Griffin Company is going to, that was like a prefab building. And so they're going to disassemble it and then actually take it over to like one of their sites and reassemble it over there. So unfortunately you won't get the fun, piece of construction equipment breaking. Dr. Mike won't get to take down this one. Unfortunately, though he did get to take down the first one. If no one's seen that on Facebook, you need to go back in Dr. Mike's Facebook and see the video of him taking down the big blue building. So everything really is moving ahead. It's a very exciting time. We thank all of you again who've donated, who've given time, our board members, the town board, the town staff, people at the county. Mecklenburg County has been very gracious as well. You remember they committed $1 million last year to this project. So we continue to enjoy success, and we're working hard to make sure we keep this thing on time and on budget.
Founder Society cost, you might have covered that.
Sure. Yeah, it starts at $2,500 is the beginner level for that, and that again that can be paid over 2 years. And then if there's no more questions about the construction or the campaign, I'd love to pass the ball for 1 second to Commissioner Biodeau. Perhaps he might say a few words. We've got some big news about the official transition of the Cornelius Arts Center over to the Kane Center. And I thought Commissioner Biodeau might be able to help out with some of that as well.
Hey, thank you, Justin. Appreciate you allowing me 1 second to make comments on the Kane Center.
You got more than that.
But it's just so exciting to talk about something positive when you hear all the negative news around us, and the timing of the completion of the Kane Center should be just right on point. When things are really back to hopefully the new normal. But the mayor mentioned I've been involved since the original committees. Since the first organization of the committees, and this is a real game changer for Cornelius. And it's not only for Cornelius, but it's for the region. So I'm really excited about that. I did want to just a couple of items that come to mind. I want to make sure that people understand this, or at least will recognize that, we're currently looking at our land use plan and zoning. I see that Aaron Tucker, our planning director, is on board. Wayne Herron's here, deputy manager in Cornelius, have really put in a lot of thought and effort. So this Kane Center will be the center of our arts district. And if you go back to those early days, pre-COVID, if you can think about it, folks like Case Watermonday and Jess and others with OTPH starting that arts movement right there in Cornelius downtown. This is something that's been a long time coming and definitely needed. It will be a place for everybody. It's a place for all ages. There will be a park. So Justin mentioned that, the good job that Troy Fitzsimmons and the park department has been doing with programming will start to transition over to the Kane Center. It'll just be a momentum builder. It's something that, as we move through the years, Cornelius will be recognized in the region as having just an outstanding arts program and an arts district. So, when I think about the Kane Center, it's an amazing project. It's something that until you actually see the shovels turn, you kind of lose sight of it. But I also would continue to jump on board, buy a brick, become a founders member, because this is something that's going to last years and years and years. You can hand down from one generation to the next. So it's closer than you think. Things are going to start moving, and I'm just really excited to see this finally come to fruition. So, as a closing note for me, it's something that, when I think about COVID and I think about the things that are happening, stay positive, test negative.
Well, that summed it up. So, Dennis, what do you think this is going to mean to our downtown or Old Town area? How do you feel about that? I know you've been involved in Old Town Cornelius for many years, even prior to you being elected to our board.
Well, Mayor, the reason I first ran for town commission was that I could see our downtown area in need of a facelift, some excitement. And just as the Kane Center was announced, we started to hear some and feel some interest. I know Jim Vogel will probably speak to that as well. But Old Mecklenburg Brewery, some of the projects that are coming to combine with the Kane Center are just going to change the whole outlook, the whole picture. It's good for economic development, and there's obviously a lot of interest in really taking care of the downtown area and refacing the way it looks today. So I think in 3 to 5 years, you won't recognize, it'll be a vital a portion of our town. Old Town District will just be an amazing place to visit.
Great. Well said. Absolutely well said. Thank you for the update, Justin. Thank you for your comments, Commissioner Biodeau. We greatly appreciate all the hard work that's going on behalf of our town. This is truly, as Dennis said, one of the bright lights going on in the town of Cornelius right now. So we're excited about it. More to come. Stay tuned. Watch your email, watch your Facebook, and you're going to get some good news very, very, very soon. So with that, one of the things that I wanted to do in these times is to do something for our businesses. Our businesses across the board in our town need help. It's been a tough year. It's absolutely been devastating to some. Others have hung on. Many have gotten creative. They've changed their ways. They've changed their methods. It's a different environment now. And we are so lucky to have an individual leading a gallant effort with our small businesses, not only in our town, but in our region, that has made such a difference. I think this was originally an outgrowth of the chamber, but it's all bigger than that. Jim Vogel has worked closely with the chamber, certainly, but he has spent an immense amount of hours trying to support our small businesses, getting them to support each other, getting them to get their message out. And he has built quite a support group, if you will, to make a difference, not only in our town, but throughout our region. Jim's a good friend. I've known him for a while. He is passionate about the subject of small business. He's one himself. And I'm going to, you'll hear these presentations on different groups of businesses, throughout our town presentations, because I think it's so important for our town to support our businesses in any way we can. So I want you to hear about this one segment of it. You'll be hearing other segments of it as we go forward. And once we make our rounds, we'll probably be back to you, Jim. So stay tuned for that. But Jim Vogel, if you'll talk to us about the LKN SBN. Thank you, sir.
Thank you, Mayor. Good evening, everybody. My name is Jim Vogel, and I chair the Lake Norman Small Business Network here in the region, the LKN SBN. I really appreciate Mayor Woody Washam and the Board of Commissioners, the town of Cornelius, its citizens, and you guys out there watching for allowing me the opportunity to share some information about the network. As everybody knows, we've mentioned COVID-19 probably 50 times tonight. The Lake Norman Small Business Network really exists now mostly on social media. We have about 9,300 members on our Facebook pages across the group pages. The main LKN SBN group page, the shop Lake Norman LKN, shop Catawba Avenue Cornelius, and our ISO LKN. And if you need to get in touch with us, it's very easy, lknsbn@yahoo.com. Very, very easy to do. We have a lknsbn.com website as well. But prior to the middle of last March, we had upwards of 100 individuals at the Old Town Public House every Wednesday morning. Of late, our attendance on Zoom and our Wednesday mornings at Old Town Public House equate to about 25% of that total collectively. That includes our D9 evenings and our BIN 110 evenings, because we are headquartered in Cornelius in those three businesses. Our growth on social media has really remained unchanged. We still have 7, 10, 12, 15 people joining every single week to our 4 pages. We are free as an organization, inclusive, welcoming, and apolitical. We help each other, asking nothing in return. This is the way every business, in fact, every person in the United States should be focused on, because these are the most unusual times we've ever had. Our eclectic membership suggests small business exists in every nook and cranny across the municipalities in Lake Norman. Hundreds exist on Catawba Avenue alone between 115 and 73. Our region is rich for small businesses, and this is what we do when we work and we serve here. We've coined the term COVID Comeback LKN 21, and all of us want to continually adopt and change with every day as we grow. Now, we offer a very simple, very important message tonight, and I want you to really listen to this. Please use us or you will lose us as small businesses. Small businesses in the region, North Carolina, and across the United States are not just affected by the pandemic and the recession, we are harmed by it. Yet the good news is we get to sail into the new normal here across the lake and focus and dedication. Our community leadership that you're seeing here tonight needs to truly lead for our small businesses, focusing on guidance and support for this network and for every other group that gets an opportunity to present itself here in this venue. Small businesses, solo professionals, charities, service organizations, they're pushing themselves every single day to compete in this complicated economy. The businesses with the greatest need for community and community support are the contact businesses that we have across the region, especially in Cornelius. Bars, restaurants, entertainment, barbershops, coffee shops, our mom and pops, we're all being challenged right now. We only ask that you place small business first, that you Google small businesses, Google near me for every need, eatery and service. Customers truly need to know that we are appreciative of them because we are small. It's all about community helping community. It's that simple. One thing is certain is that the Lake Norman small business owners and solopreneurs have to prepare for the unknown and the uncertainty. No one knows what's going to happen the rest of this year. We just don't. Our restaurants and eateries offer smaller menus. They offer delivery, curbside carryout, outdoor dining. Most of them are at the 30% to 50% level of where they were a year ago. And that's on a good day. All of us are offering no-touch payments, virtual services. We're growing with e-commerce. We've got remote businesses growing. We are training, retraining, and reskilling every employee. We're just focusing on survival with joint ventures. We collaborate. We really try to grow the strategy that way. We're utilizing social media across the board to promote our businesses like never before. We're using Facebook and Twitter and Instagram and all of those to succeed. We are trying to mobilize mobile at every opportunity. In 21, we're focusing on delivering experience across the board and deliver that focus all the way through the rest of the year. And we grow through Google reviews, we grow through Facebook recommendations. Please 5-star your favorite business that is small and give them an opportunity to really show off how good they really are. Because we get things done right by doing things right. Remember to lose, we have to remember, you have to use us or you're going to lose us. Please continue to shop online, purchase gift cards, shop sidewalk sales, get carry out and so much more. And man, I really appreciate the opportunity tonight to present those thoughts. Thank you so much for letting me be here tonight.
Thank you so much, Jim. We greatly appreciate that. Let me ask you something. So how many folks do you have out there with, I don't know if you call them contacts on your Facebook page? What are you up to now? I mean, there were some tremendous numbers at one time.
Yeah, collectively, we're over almost 9,300. We have 4,500 people on our Facebook, main Facebook page, about 2,000 on our Shop Lake Norman LKN page. We have a website for that as well. And we have about 900, almost 1,000 on our Shop Catawba page. It's my favorite page because there's a lot of action, reach, and engagement on those pages, especially the Catawba one. But there are a lot of people out there. At one time, Mayor, we had 400 people cruise through every month at our venues. We had 4 regulars they wouldn't miss a beat. And we always had 4 brand new people. So you got that 444 thing going all the time. Now we have 21, 22 on Zoom. Sometimes because I've done what they want us to do and stay home. But at Old Town Public House on Wednesday mornings, we might have just 6 or 7. So it's really been challenging.
Gotcha. What a great service to make all those connections. I do want to call on one of our commissioners, Commissioner Tricia Sisson, is a small business here in our town as well. And Tricia is a former chairman of the chamber, and I know has worked with you in lots of things as well. So Tricia, what would you add to what Jim has said about your absolute passion for business in our community, and particularly small business?
Yeah, thank you, Mayor.
Sorry to surprise you with that call on, but anyway, I know you'll answer well.
I never tire of talking about our small businesses in the Cornelius Lake Norman communities at all. Jim, really totally passionate, and I expected nothing less. You did an amazing job. That plea is so heartfelt and it is so needed. Our small businesses are struggling, and we really do as a community need to group together and need to support those businesses, and you did an amazing job. I've been a member of LKN SBN for years now, and Jim really offered something to the community in terms of a way that these small business owners could connect and could bounce ideas off of one another. And there's just so much entrepreneurship that comes out of his meetings. And I know that he's looking forward to the time where they can get these small businesses back together again and ideate and create things and really get to know the new members that are going to want to come in. But we've got to keep them around. So Jim's plea was spot on. And I hope that everyone on this call today will go right out and support a local business and do so all weekend long. So thank you, Jim.
Thank you, Tricia. Appreciate it.
Absolutely great. Well, very well said. And, you know, small business in our community employs most of the people that work in our community. You got to know that. And we've got some big employers like Charlotte-Mecklenburg Schools, Town of Cornelius, Financial Independence Group, Lake Norman Chrysler. I mean, there's a long list of very large employers. However, I still propose the fact that if you add them all up, small businesses are going to employ even more than those big guys. So, you know, we got to shop local, folks. It's just down to that. Many of them have adjusted with the times and have great web services where you can pick up at the front door if you don't want to go inside, or in these times that might not be a bad idea, but they've got ways to shop with them that they've never had. So I just encourage you to use that and certainly make the best of it. So thank you, Jim, and thank you, Tricia, for your comments as well. So with that, you know, we can move along, I think, to any questions that may be out there. So let me look at our question box, and Danny, tell me there's no open questions. I guess that means we have addressed them. So if anybody has any questions, go ahead and put those in the chat box, and we will certainly get to that. So based on the topics we have tonight, commissioners that are still with us online, do you have anything for any of our presenters, i.e. Dr. Washington, Kane Center, Justin Dion, or Jim Vogel about small business? Any questions or comments you commissioners would like to make, or any of our staff?
Just kudos for all you're doing.
I'd just like to say thank you again to the finance department for the outstanding work that you all have done and continue to do. We really appreciate it. Couldn't run this town without you guys, and you do some really, really solid work. Some of the best fiscal work I've seen in any town. And Julie, I love your dog. We're gonna have to get Cruz and your Siberian together. They're both Siberians, and they get along great. There you go. There you go. Well, we've got a lot going on in our town. We without question, are busy even in these times. So please stay tuned to what's going on. We've had a number of open public hearings going on. We had two this past Monday. One of them was a project, last Tuesday. One of them was a project on Mays Road, a residential project, and the other one was the first hearing on our budget. We really want to hear from our citizens. You heard that from the town manager, and I'll remind you again that there's an opportunity to give us feedback on what's important to you in relation to your priorities, your own priorities in the budget. We have our own. We do represent you, and we want to make sure that feedback gets in place. So anyway, here's a question about, are there any COVID statistics, Dr. Washington, about transmission or positivity rates for K-12 age kids? And that's from Mike. You have any comment on that for the younger group?
Yeah, sure. So we don't actually have positivity rates per se, or infection rates by age group. We certainly do know, though, that the majority of our cases in Mecklenburg County are in younger adults. We do have, I believe, and I shouldn't say this off the top of my head, but I believe it's about 16 or 17% of the cases are in individuals under the age of 19 and younger. So we certainly have cases among children. We have cases among children as young as newborns. You probably saw a report just last week that we had in the last month, there have been 6 newborn babies with COVID-19. So, but I don't have an exact positivity rate. So among those who are tested, how many are positive, but something we can look into whether or not we can provide.
Okay, so you hear a lot of conversation going on right now, particularly at the national level, about the increased, I guess, sourcing for vaccines, really throughout the country. What are y'all hearing about that? Is it really going to make a difference? Is it really going to accelerate this process, or are we maxed out with what we can do? How's more vaccines gonna help?
Yeah, so another great question. So vaccine right now is currently being procured solely by the federal government. So they are basically buying vaccine on behalf of all US citizens, and they are essentially distributing that vaccine on a per capita basis. So currently, I believe we are on schedule to continue the current levels of supply indefinitely. But we certainly are anticipating that there will be additional vaccines brought online here eventually. And so as additional vaccines come, again, that's just another tool that we'll have in our toolbox and really able to offer more options. Currently, there are just 2. We have the Pfizer vaccine and we have the Moderna vaccine, both of which require 2 doses. So that's another level of challenge because we have to reserve a certain amount of the vaccine to make sure we can get folks their second dose, which we are committed to ensuring that individuals are able to get their second dose and that we have supply on hand. So that adds another layer of complexity to the supply chain. But we're hopeful that we'll continue to receive at least this level of vaccine and potentially more as work happens at the federal level to procure more from the 2 vendors that currently have emergency use authorization. And then once additional EUAs are passed or approved, we hope to have more of those vaccines as well. So I think, again, as I said earlier, the vaccine deployment or distribution right now is a light at the end of the tunnel. It's just a pretty long tunnel. And so we got a ways to go in terms of time just to get enough vaccine for everybody to have it.
Thank you, sir. So I think I saw Chief Black out there. Chief, tell us about, or Major Baucom, tell us about our business community as a whole. Are we complying pretty well with the guidelines, or how do you view that? I know we've had some issues along the way, but how's that going?
Mayor, it seems to be going fairly well. We've had very few complaints from the public reference to in the early stages when we had businesses that weren't supposed to be open that are authorized by the governor's order. As those things relaxed and gyms were allowed to be open, that was our main problem. It was workout facilities. We have seen a rise in some here recently that we've spoken to, but that's been on a as needed basis. We hadn't received any complaints. We just happened to go on a call at that particular business and seen something that we addressed through education, and hopefully we'll gain compliance out of those folks.
Great, thank you. Major Baucom, you have anything to add to that?
No, sir, I don't. Like I say, the chief is following what he said. Just some early complaints, but nothing really to speak of recently.
Yeah, gotcha. Okay, well, thank you, folks. Dr. Washington, how are we looking in Cornelius? I know our numbers are going up, but how would you characterize the COVID environment in the town of Cornelius?
Yeah, great question. So we do every 3 weeks, I believe, we update sort of town-based reports just so we can have a sense of what's happening across the various municipalities within Mecklenburg County. And so Cornelius is, again, situation is very similar as it is in other parts of the county. We continue to see an elevated number of cases over the course of the last several weeks. I can tell you we were averaging around 50 cases before the holiday season, and then we increased in Cornelius specifically as many as 172 cases in a week. Most of the cases still continue to be in younger adults, ages 20 to 39 and 40 to 59 represent about 65% of the cases. And then just for reference, 0 to 19 age group represents about 17% of the cases. And currently in Cornelius, there's only one facility that's congregate living and outbreak status. And there have been 19 deaths among residents in Cornelius.
Okay, well, thank you for that update. We get that question often as to how we fit into these staggering numbers we're hearing, at the county level and state level and so forth. So with that, I would thank everybody. We did get one question earlier about, how we're going to be doing these Connecting Cornelius events as we move forward. We would love to go live. We really have enjoyed and I think broadened our audiences significantly by offering the Zoom or Facebook alternative to participate in these events. We will always do Zoom. I'm looking forward to the day we can get back to in person. And, typically we have our Connecting Cornelius coffee chats at Harvey's, or now known as H2 in Cornelius in Jatun Village. And we typically have our after hours at one of our breweries or one of our draft houses. So we'll consider doing that. And, I'm a people person, and many of our commissioners are the same. And as soon as we can get back live, we want to do that. But we'll always offer the Zoom or the Facebook Live alternative to this coverage because that puts it out there. It's out there. You can look at it after the fact and, just keep in touch better. So with that, I will again thank everybody for your attendance tonight, your interest in your town. Our next event will be our coffee chat, which will occur by Zoom. I believe that date is February the 1st. It's the first Monday in February. Correct me if I'm wrong about that, Danny. I think I got that date right, but it will be at 8:30 in the morning and it will go for an hour. And we've got a great array of topics to cover with you this year. So stand by and you'll be hearing the details on our next event, February 1 at 8:30 p.m. So thanks again. Please stay safe, everybody. And again, Happy New Year to everyone in our town. So thanks a lot. Good evening.